Hello, it's Dr. John Petrick, and welcome to the Ask Dr. John show. Today, I'm sitting with a really good friend of mine and colleague, someone that I admire, and someone that I'd love to work with. His name's Dr. Pinniger. Together, we're going to be working on a protocol called the manipulation under anesthesia of a right shoulder. Patient presented with ultimately no ranges of motion in the shoulder, completely locked down. The humerus is stuck up into the capsule, and I'm going to attempt to free it up. And Doc at that time is going to go ahead, he's going to put some injection, he's going to put some PRP, which is platelet-rich plasma, which we'll talk a little about. Have you done other procedures, obviously, with platelets, correct?
Yeah, platelets and stem cells, it's a craze right now. You have promotions and advertisements and billboards, I mean, they're all around town, and there's a lot of hype about these procedures. And there are extremely amazing results and potential for them if done in the right setting. And this is a great place to do this. You have a lady with extremely inflamed shoulder, no range of motion as you're describing, and we need to both kickstart her range of motion and revamp her inflammatory process so that she can heal.
Yeah, and it's going to be one of those things too that this poor woman has been suffering with this frozen shoulder for almost 5 to 6 months. To the point she can't sleep, she can't eat, can't comb her hair, can't put her bra on, can't pick up her son. Miserable. So if you know anybody out there with frozen shoulder, they truly should give us a call. I mean, because one of the things that we can do really is try manipulation with anesthesia. And if I'll tell you what, if you're thinking about it and you have someone out there that you know that has a condition, and it's really, really important that they get these things treated. So is there anything else you want to say?
Other than just some background on the problem itself, if that may be helpful information, the frozen shoulder, it's not a rotator cuff problem. It's not a problem with a tear. It's a problem with tightness, and it's a problem of those ligaments becoming contracted and those muscles becoming bound. And you when you have a friend or a family member who you can't raise their arm, they can't raise their arm, they're just socked in there. That's exactly what this is talking about.
And one of the things that, as Doc did a good job of kind of analyzing and kind of breaking that down for us, frozen shoulder is probably one of the most horrific things that patients deal with in regards to pain. It is so painful that patients really have a very terrible life ahead of them. So it's really what a great experience it is to be able to go in there and help that. So I hope today's procedure is a success. I'm looking forward to working with you again, and when we'll go down there and see what we can do. Let's see if we can help her.
I like it. Thank you.
So right now what they're doing is they're drawing the patient's blood, and they're going to draw off all of the platelets, and then they're going to inject it back into the patient. They're going to enrich the plasma with all those platelets. It's just going to help with pain. It's going to help with regeneration. You'll also see that it's also going to help. It has a little serotonin in it, so it's going to help the patient with pain. But at this particular point, what they're doing is drawing off the blood to enrich the plasma.
What we have here, this is a centrifuge specifically designed to concentrate the blood layer that we just withdrew. So 15 cc's are drawn from the patient. Now we put it in a centrifuge. It spins at a rate of around 1500 RPMs, specifically designed to take a certain percentage of blood cells, but mostly to collect the platelet layer. The platelet layer has what we're looking for. It has the platelet-derived growth factors, it has the cytokines, it has all the pieces that we want to use to promote the correct inflammation and restore some healing process to her shoulder. So this gets placed into here, spins for a few minutes, and it collects that percentage that we're looking for, and then that will be used to place back into the shoulder.
So right now we're treating the subscapularis muscle, which is its primary responsibility is to hold the humeral head down and back. I've already, at this particular point, freed up most of the posterior capsule, subscapularis. We're going to hit the posterior shoulder as well, infraspinatus, teres major, teres minor with this, but she's already been through a lot of freedom of this motion already. Look how much better that is. Doc.
Yeah. She couldn't get to even 90 degrees in the office.
One of the most painful things patients deal with is frozen shoulder that we come in contact with. But look how beautiful this is now. Their posterior capsule loosened up. Her whole life has changed. We see this all the time when they get these free. Terrible.
So are you holding onto the scapula?
I'm holding the subscapularis. The technique we're using is called active release, okay? So I'm holding the subscap, letting the tissue pass underneath my finger, and it breaks all those fibers free. I like to equate it to a kind of like a paintbrush with the paint lifter and the bristles. After 25 years, you kind of get an idea of what they'd feel like. And she's pretty much already free, huh? Isn't that awesome?
That's real good. Would you like me to open? We can open the gown and still
Yeah,
cover her, so you
let's
can
do
see
that.
where your fingers are a little more if you'd like to. See what we do
It's
in a
kind of
minute.
tactile. I'm pretty good, but this is what a wonderful. She's going to be so much beneficial when she
Taken
wakes up.
so you can visualize
Yeah,
what your fingers
thank
are
you,
doing
thank
a
you,
little
sir.
more.
Thank you.
And this would be an incredibly stimulating maneuver. If you tried to do this on someone who was awake.
There's no way we would be able to do any of this with her while she was awake.
Right.
We had zero range of motion whatsoever, none.
Zero?
Absolutely. I mean, he'll tell you, it was terrible.
Wow.
Unfortunately for her,
Passive and active.
the active component was probably less than, I mean, she had none in regards to rotation. She's still, oh, there we go.
One of the diagnostic criteria for a frozen shoulder is that the active should be almost equal to the passive. So when a person comes into your office and they say, I can go to here, but you can take them up overhead,
Yeah.
that is not frozen shoulder.
Right.
Now it's a muscle problem but when they get capsular tightness like this, you can't do any better than they can.
They link it to, they say it could be the spinal accessory nerve locking down. It's a motor unit for the rhomboid.
Yeah.
I mean, I cannot wait for her to wake up. She's going to feel so much better. I can't.
Mm-hmm.
That awesome.
My documentation for my office note, she was 70 forward flexion, 30 abduction, 10 degrees external rotation, and she could get to the hip right here. And so the amount of motion she'll have after will be triple.
Could be a game changer for us.
It's life changer. Unfortunately, what they've linked is 42% of the people with frozen shoulder, they link to Parkinson's, MS, and other conditions. You know, what do we look for when we take an MRI of the brain? We're looking for those calcium deposits, right? And those cells become permeable to calcium, so unfortunately, they lose their cell membranes, start to break free. And
But
makes-
58% not, so more likely than not you don't have that.
right? Right? That's right.
So hopefully she's in that 58%.
She's gonna do fine, huh?
Yeah.
Doc, I'm almost finished. I got this about as free as.
What's the risk of recurrence?
It's very slight. Very slight. Once we're free and all those adhesions are broken free, she's free.
It's almost not higher risk than the regular population.
Yeah, that'll be fine to respin it.
So when we first started, the patient had 70 degrees of forward flexion. Right now, after the manipulation, we've almost got patient for 100%. She's doing fantastic.
See, that's real good.
This is what we're looking for. I freed up posterior, anterior capsules. She's doing really, really well. This is a huge success already. Before we even get that injection in, she's going to do so well. All right, I'm ready to go if you are.
Okay.
Yep.
All right, so the blood sample that we obtained, it's already finished the centrifuge process, so now we'll pull this out and we have to very carefully separate these layers. So if you'll notice, the red blood cell layer has been pressed to the bottom because it's heavier. So you see the separation in the two samples here. Red cells low, the plasma up high, and the platelets are contained in that plasma yellow layer.
I'm gonna start.
So we then
I'm getting
take this,
used to my work with
the specialized syringe, and as we draw this back,
So my career
we're
here's where I
obtaining
wanna be.
that yellow layer while avoiding the red layer. And we usually, after a sample like this, we'll get somewhere near 4 to 5 cc's.
Is she a right
And there are ways to hyper-concentrate this if we need to.
And then count.
So you can see that that's mostly yellow. I'm just getting to the tip of the red. So now we can take this and remove it. If you look, we're seeing the biceps tendon, greater tuberosity, biceps tendon, lesser tuberosity. If we scoot in from lesser, here's subscapularis, and we get into glenoid. So if I can get the injection to go right under subscapularis toward the arc of the socket, toward the glenoid, we'll be right in the spot.
And when I was doing the procedure, one of the first things that actually freed her up was that posterior capsule and that subscap. So right where you're going to put it.
Right where we're putting
perfect.
it. Awesome. Sounds very good. So I'll photo this right here just to give us. All right. So we have our sample ready for the, and PRP stands for platelet-rich plasma, which, like I described when we're centrifuging this, we are harvesting and collecting the platelet layer. So the platelets have the growth factors, they have inflammatory cytokines, and we're trying to promote that reaction. So we set up our ultrasound so that as we go across here, we have visualization of our biceps tendon, our lesser tuberosity. As we scooch a little farther over, this is our subscapularis tendon. Straight in this space is the joint. You have the edge of the humerus and you're getting to the glenoid. And right in that space is where we're targeting with this so that it gets inside the actual joint. So we've cleansed this area with alcohol. And then following our target here, you can see my needle. It's that sharp line to the top left. And if I demonstrate it here, that is the needle here. And if I keep the trajectory underneath the subscapularis, I will hit right where I'm trying to go. And there's the subscapularis starting to tent. And there we are inside the joint. So as I start to inflate, you can see it elevate the subscapularis slightly. That's going very smooth into the glenohumeral joint, which is exactly what we want. And that's the whole thing. Clean her off from all our ultrasound gel, simple Band-Aid. And the platelets will then act as the recruitment cells for everything that we want to enter into the shoulder joint. So we will now be recruiting those inflammatory cells, trying to promote that response. She's going to avoid the Aleve, the ibuprofen, so that we can encourage that process as opposed to halt that process. And as she gets working, continues with Dr. Patrick here for her range of motion, her active release, this is going to change her life.
So Dr. Pinniger and I just got done finishing a manipulation under anesthesia. It was an absolute wonderful success. Patients coming in now. Doc did a great job. We got the PRP right where we needed it, right in that joint capsule. Wonderful opportunity. When the patient wakes up, she is going to be feeling so much better. It's a wonderful thing. The shoulder has full range of motion at this particular point. The PRP is where it needs to be, and we're going to call this particular procedure a absolute success. So right now they're putting a little bit of ice on her shoulder. It kind of helps with if there's any particular swelling there shouldn't be. It's going to really more of a feel-good thing. It's not really doing much.
Not going to get so deep that it interferes with anything that we had to do there. But,
Correct.
But it'll definitely give her a calming effect. Help with that post-manipulation pain. It's so amazing to take a person who in the office had not even 90 degrees of range of motion, and to see you have her arm up over her head, rotating out to the side. She couldn't even reach behind her back in any way. She was only getting to the crest of the hip. So satisfying and relieving to see her be able to.
Her life has changed. The great thing about it is this is a patient that was heading for a life of nothing but pain and misery, and now here in a very short period of time, she's going to wake up and she's going to have a whole new life. It's wonderful.
It's fantastic.
Held her posterior capsule, held the subscap. opened it up. As soon as I was opening it up, what I was feeling the folds of the capsule.
Yeah.
And I could feel it. So as soon as I put my thumb in there, I was like, oh my God, it's going to go now. Went up, she gave me a couple of little click, 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 click. And then it just totally loosened up. On the posterior side of the shoulder with the teres minor and the major, I wasn't feeling as much of the adhesion. And then as soon as we got all the way up to extension, it popped that posterior capsule free. Yeah, it was wonderful. Really, really, really good.
And it needs to be a progressive, slow stretch to let that tissue creep, to let it elongate. Because if you take that and just go fast, I've been inside a shoulder with an arthroscopy following a manipulation before, and all those ligaments are now shredded to pieces.
Yeah,
and
they
now the
create
shoulder
more damage. Yeah, there's a technique to it. I hate to say it. I had some really good mentors that really allow you to teach you that skill set. And she's going to wake up here in probably like 5-10 minutes, and she's going to full range of motion of that shoulder. And with what you did right now, with the injection, I mean, she's on her way to healing. And regenerative medicine is really the wave of the future. I'm so glad we do that. As opposed to a corticosteroid shot, which is for inflammation, this is opposite. We actually want to create inflammation into the shoulder so that the tissue starts to heal. And there's serotonin in the serum, so she's getting some pain relief naturally from what's already in the body. It's pretty interesting. Good news. Guess what? That arm went all the way over your head.
Oh, good.
This was a wonderful success today. I'm so happy for you. Yeah, right? Wait, Doc did the injection perfectly, right in the area we needed it. The shoulder moved all the way over your head, up and down and around. New life ahead of you.
I'm so glad because it worked out.
Perfect. Perfect.
No
Yes, we're going to. Yeah, we'll sneak out in a minute. Come talk with him.
Yeah.
Thank you.
You're going to enjoy this little Labor Day weekend.
But the pain is ongoing.
Yeah, you're in a lot of pain right now. You're going to experience some pain. They're going to give you something for pain, and it's associated. We just did like 7 months of therapy in one day, in about 20 minutes. And the pain from the injections, can be a little bit of pain from the injection site too, okay? What you're experiencing is the PRP, it's in there. And what that's doing is it's creating a kind of like a matrix in there to get that tissue to start to heal and you're on the mend. So that's what you're experiencing right now, some of that pain.
Now, what are my limits?
Really, we're not going to limit you too much. We don't want you lifting anything crazy heavy. You know, we just want you kind of moving it. Enjoy your life. That's what we want you to do.
Because I have a chair at home that moves it for me.
You're not going to, you can do that, but you're probably going to pretty much be on your own. Just be as active as you possibly can. We don't want you doing too much because we want that PRP to create, you know, we want it to kind of help heal that. But you be as normal, live normal, enjoy your life. You know, I mean, just kind of do things that you normally want to do. Go shopping, do different things that you can. Again, don't go crazy.
Can I leave it in the med room, or do you think you'll need it this weekend?
So the pain is actually going down my forearm. Is that normal?
Very normal.
Okay.
Very normal. Remember, we had that radial nerve and that nerve that was going down. And if you remember before you even in manipulation, we were treating the elbow because the radial nerve as it comes around that side, right? You can move your arm if you want to. Move around a little bit. It's not.
It's painful.
Got you.
So I could, like last night, I could put my arm on my forehead. Like you know that, oh my gosh, kind of thing. I was never able to do that. So.
I can't wait for you to see where you're at now. You're gonna go.
And then I want my husband to be at the appointment where, are you going to show me the video? I want him there. So that would have to be like a Thursday.
We're gonna go to the post edit.
Or Friday.
And my camera guy, who is absolutely fantastic, he's a creative director, he's going to edit all of this for you, and then you'll be able to show it to your family, and you'll see the entire process, even from where Doc injected the needle under ultrasound. You're going to see the whole thing. It's really a great deal. Thank you for letting us video that. It was really cool.
Oh no, I mean, are you going to post it anywhere?
We have your permission to do so, then we'll probably do that, okay, if we have your permission.
On YouTube?
We're going to do a few different places for you.
I would love to see that.
Yeah.
You were able to get full motion.
We got full range of motion. Put it this way, it was way better than I thought it was going to be. You were probably one of the most adhered we had had. That tissue was totally locked down. And within about 5 or 6 seconds, when I got to the subscapularis under the armpit that I was telling you about, and I rotated that up, your arm went click, 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 perfect. Doc and I were sitting there, and we were literally going to almost high five because it was such a wonderful success. I'm so happy for you. All the way up. Now you're going to be in it. Obviously, it could be a great deal of pain because we just freed that up, but we're gonna be okay with that. All right.
But it's nothing like pain.
No. Guess what? You're going to get your full night's sleep soon. You not have that terrible.
Well, I've been sleeping better.
Since we treated me. Yeah. Good.
I think that stress relief method kind of helped. So.
Get some of that stress off,
Yeah,
huh?
and I got a lot done with the audit. One audit's done. So.
Oh, you did?
One more left.
She's an accountant, so we're getting through an audit. We're not going to blame this on the audit, but what we are going to say is it's going to be much easier, isn't it?
Yeah, I'm sure the stress helped with the
Right?
situation, but
Yeah.
it's over.
Hi. How are you? Good. Jet? Good, good. So the procedure was fantastic, okay? Within about 30 seconds, we were in there. She was totally unconscious. She was ready to go. I manipulated all the soft tissue. Her arm went right up over her head. So for the first time, obviously she didn't feel anything while she was unconscious. And then Doc went ahead and he did the injection. We're going to show you, if you want to see, Doc's going to show you. This is Dr. Pinniger. I don't know if you had an opportunity to meet prior to. You met him earlier?
Yeah,
Good,
briefly
very good.
right before.
And this young man's Jet.
Jet's the man. He's wearing the right T-shirt.
That's right. So Jet, what we're going to show you is the actual injection that your mom got in her shoulder, okay? And then we're going to show you on film what I did when I manipulated the shoulder while your mom was under anesthesia. And it was fantastic. You know what your mom's going to do? She's going to pick you up next week. She's going to big hug.
Ready for her to wrestle you? So here in the shoulder, this is her biceps tendon. You see the front of the actual humerus. This is where the rotator cuff starts to attach with the subscapularis, and we see the socket. So the ball and socket joints here, and that's what he was working to loosen up, is all the tissue around the ball and socket joint that was stopping it from being able to move. So my point is to target that area with that injection. We took that sample of her blood, and then you can see my needle entering into that space, starting to go right around the corner toward there. And here you see the needle all the way in, and you start to see the fluid expanding the capsule. So right at that entrance of the ball and socket, the fluid's beginning to open up that tissue, and then it sits right where we were trying to put it. So the ultrasound just makes sure I target the right area.
So, now, the next couple of days, it's important that she just take her shopping. Do something, let her have. I know she said that she goes, I can go shopping. I said, yeah, you can. I said, do you want me? Your husband's going to say, put it back. But she can be active, okay? We don't want her lifting anything heavy. Don't do anything crazy. She doesn't need to go kite sailing or anything like that. No skiing, okay? But we want her back ultimately on Tuesday, after the holiday. Enjoy your weekend. This is going to be a fantastic weekend. She's on the mend. Your wife is going to be much, much better. I hate to say that we're giving you back your wife in much better condition than we found her. Okay?
Tuned her up. She's ready to go.
You'll see. And again, that arm went completely over her head. Doc will tell you. It was like,
awesome.
It totally broke free for me. I could feel it. The capsule unfolded. Next thing you know, all that went right up over there. So she's in a little bit of pain. That's to be associated with this. We just did a lot of treatment in 15 minutes, right? So she's going to be a little bit sore, but she's going to be so much better. I can't wait. And she's going to get a lot of rest. So I'll probably see this weekend and be a good time to say, hey, let mom have some rest, and she's going to be great. So, anything you want to add in there?
Like we talked about, just the restrictions on some of the anti-inflammatories. That medicine is promoting inflammation. So if you take a bunch of ibuprofen, a bunch of Aleve, you'll negate some of that effect. So avoid those for now. A little bit of ice on the surface of the shoulder for 10, 15 minutes at a time. Won't get deep enough to interact as much with what we're doing, but otherwise, lots of range of motion.
Yeah, get her moving. Don't be afraid to help her. get that over, work some of the product that he put in there. And remember, we drew the blood from her, we injected it into the arm, so get it moving so you can kind of, you can help her. You can say, here, honey, I'm going to move this around and do this, and just have at it. But you don't want to let it sit and then it heats up again, so keep her moving. So the more you can move her probably the weekend in regards to movement, the better off she'll be.
Okay.
Tell her you need something off that top shelf.
That's right.
I need you to
Can
get that for me.
cereal.
Yeah. Yeah.
If you know, that was aimed at me because that's a short joke. Okay.
Can you get up there? Can you get that? I need you to change this light. Come on.
So do you want to see her? All right. So let's go next door. And there is our happy patient.
That was worse. This pain is worse than labor.
Good. You want to get her moving as soon as possible too. So when you get her home, make sure you can get the arm. It may kind of have what's known as a kind of a little bit of a rebound, where it's just going to want to kind of freeze up.
Chair at home.
Use it, because next week we really start the rehab. Okay, we're really going to start to push the rehab, and we'll show you the edited version of that, so you'll see that arm go completely up. It's really, really important if you get it moving, okay, as much as possible.
I just want to be knocked out again.
Didn't I tell you? You're going to say, put me back out, put me back out.
Yes. Until that painkiller kicks in. It's worse than labor.
I wouldn't know.
Good.
You're no help there, right?
Hey, welcome back. Dr. John Petrick here, and my man, thank you so much for the wonderful procedure. Success! The patient's arm went completely over her head. Wonderful doc on ultrasound. You could actually see it, put the needle right on target, injected that PRP. How wonderful was this that we got to do this procedure today?
What a good experience to see someone who cannot move and leave the treatment room with completely full range of motion. It's going to change your life.
It is exciting, I can tell you. I know one of the things we talk about in the medical community is good doctors talk about success and great doctors talk about failures, and we hate failing. And for us, it is such jubilation and pure joy to be able to have such a wonderful, successful procedure and be able to give this woman back her life. She's going to pick up her kid, she's going to hug her husband, she's going to have a fantastic life now. And prior to this woman was in absolute misery. Wasn't that exciting?
Absolutely.
When you saw the shoulder go all the way up, right? When we first started, and I located the subscap, and when I could feel it, it felt ropey. So people always say, hey, Dr. Petrick, what are you feeling for? And I'm Italian, so I'm gonna use it this. I'm feeling for that al dente linguine. I'm really trying to feel that tissue. It's kind of ropey. And once I located it and I brought the shoulder right up over her head, it went straight up. I could feel all the tissue breaking free, the folds of the capsule and everything. And within literally, 30 seconds to a minute and a half, almost full ranges of motion. So, and no humeral fractures. She's got full ranges of motion. And then once I was finished, we needed the PRP because that's the healing part. That's the healing part that ultimately is going to make the success and hopefully really kind of give us what we wanted. But a wonderful success. Thank you so much, man. That was a blast.
Pleasure
I appreciate
working
it.
with you.
Thank you,
Great,
man.
man.
We'll do more of those.
Let's do it.